Welcome to the East-West Center Research Program Speaker Series. The East-West Center Speaker Series is a recurring program to spotlight emerging developments across the region. Through this series, we explore the environmental, demographic, political, and economic processes that are reshaping the Asia-Pacific region in profound ways. Thank you for joining us today, and we're delighted to welcome a special guest. Marjorie Pajaron joins us today from the University of the Philippines at Diliman, a visiting scholar most recently at Stanford. She's going to share a talk entitled The Environmental Migration of Filipino Nurses and Doctors. And as we all know, the Philippines is one of the top exporters of healthcare professionals in the world and arguably a leader in providing high-quality healthcare professionals to regional and global healthcare systems facing workforce shortages. It gives us a great privilege to welcome you back to the center, as Marjorie was here some time ago completing her studies at the university, but also here at the East-West Center. She was one of our staffers. Most recently, as I shared, she's come from Stanford, where she was a visiting scholar at the Shorenstein Asia Pacific Research Center. She's an associate professor at the University of the Philippines, Diliman, and has held previous fellowships also at Stanford on health policy and University of Manchester's Global Development Institute. So without further ado, let me welcome you back to the East-West Center to Honolulu and look forward to hearing your remarks. Thank you.
Okay, so good afternoon again, everyone. Like Carlos has introduced me, I'm Marjorie, and I'm here to present the recent research paper that we're working on at Stanford University, and it's entitled Environmental Migration of Filipino Nurses and Doctors. Let's see if this works. Okay, so as an introduction, in 2021, over 50% of the world's population lacked access to essential health services. And this is directly linked with the availability and capacity of the health workforce. However, World Health Organization projected that there will be a global shortage of health workers, and it's going to be about 11 million by 2030. This shortage is unequally distributed, predominantly found in the Southeast Asian region. Here, as you can see, we have here the trend in the distribution of inequality in the health workforce. So as you can see from in 2013, most of the shortage predominantly came from Southeast Asian region, and then by 2020 onwards, it became the African region as the source of the most shortage in health workforce. So what are the different reasons for shortages? The first one, it could be lack of new graduates or lack of available jobs in the health system to absorb these new graduates. Another would be unfavorable working conditions like low salary comparatively. Also, for example, and which prompts individuals or health workers to migrate to other countries. So coming from the health workforce, we now proceed to the nurses, because nurses constitute the largest portion of the health workforce. So similarly, there is an inequitable global shortage of nurses, and high-income countries like the US and the European countries, although they represent 17% of the world's population, only 17%, they actually have 46% of the world's nursing population. So the rest of the world share that other pie, the 50% of the pie. And then the shortages of nurses in low and middle income countries obviously could have a deterrent effect in achieving the health-related SDGs and targets. For example, achieving universal health care, improved maternal and child care, lower NCDs or non-communicable diseases, and emergency preparedness and responses. WHO in 2025 reports that 1 out of 7 nurses actually practices in a country where they were neither born nor trained. So meaning they migrated from another country. And so this increasing trend in the international mobility of nurses exacerbates the already existing inequality of global supply of nurses. Okay, so let me talk about Filipino health workers migration. So this is what Carlos already said. So the Philippines is one of the top exporters of high-skilled health professionals, and they export to not just countries within the region, ASEAN region, but also globally. And this is to meet the different shortages found in aging societies like the US and European countries. Briefly, I want to show you first like the overseas deployment statistics. So these are temporary or contractual migrant workers who leave the country for a while and then they go back after their contract. So this only constitutes a portion of migration. We also have permanent migration. And this data is only for 2025. So as you can see here, about 1.6 were deployed contractually in 2025, 1.6 million. And mostly came from the national capital region or from Manila. And 50-50, so 50% male, 50% female, almost. Most of them go to Saudi Arabia and other Middle Eastern countries, but most of their jobs are actually, let's see, so mostly elementary occupations. So meaning requiring less skilled type of work or less skills. For example, domestic workers, cleaning, etc. And then nursing professionals only constitute about 2%, okay, for the second quarter of 2025. Okay, so looking at the trend of migration of nurses, so you can see here an increasing trend. This again is for temporary migrants. Okay, so an increasing trend from the based on the data that we have from 1990 up until about 2015. Okay, and then it decreased because of all the travel restrictions during COVID-19. And then if we compare this with permanent migration of nurses, you see a kind of different time trend between permanent and temporary migration of nurses. So you see here it's not showing. Anyways, so the red line is the temporary migration. It peaks at around 23,000 in 2015. And then the permanent migration peaks at around 2006. And based on the data, so we can conjecture that this is the period where there was there were visa expansion policies in the US, which actually attracted more nurses in the US. So that peak, and also, so that's the pull factor. The push factor could be all the typhoons that happened, or even the super typhoons that happened around this period. So another graphical representation of the data, you can see here the top destination of temporary migrant nurses. So mostly they go to Saudi Arabia as contractual migrant nurses. And then the US used to be, but then like 2 decades or so later, it became United Kingdom and Germany, Europe, and then other ASEAN countries like Singapore. In terms of the top destination countries of Filipino immigrant or permanent migrants, so most of the health professionals, Filipino health professionals, go to the US and Canada. So I'm sure if you go to the hospital or somebody you know, a healthcare provider is a nurse. is a Filipino nurse or a Filipino doctor here in the US. So the statistics also show that. The same with nurses, mostly go to the US and Canada. Okay, so to match this, so we see that there's an increasing trend of migration of health workers and nurses from the Philippines, both permanently and temporarily. And we want to compare that with the amount of nursing graduates and the trend in the nursing graduates. So we see actually there was a decrease in this period. So yeah, so during the pandemic also there was a decrease in the number of nurses, and then it started to increase post-pandemic. Okay, so now we've seen the side of the migration of health workers. So like in this research, we are actually linking two strands of literature. So one is the migration of health workers and the other is environmental migration, and linking these two strands. So in this part, I will show you the different environmental factors that actually contribute to the migration of health professionals. So this paper actually is an extension of our paper already that was published at the Journal of Population Economics. So, but that's migration of Filipinos in general. But this one, we want to focus if this is also true for health professionals. So the Philippines is ranked third globally in terms of vulnerability to climate change risks or to different environmental risks. So sometimes it's the first, sometimes it's the third, depending on the index used, climate risk index, etc., or natural disaster index, and depending on the institution or the organization measuring the risk. But it has consistently ranked from first to fifth at least. And the different manifestations of climate change could be extreme tropical cyclones or more frequent and more intense typhoons. So as you all know, like the super typhoon word has just been recently coined because the intensity of the wind speed in typhoon has dramatically increased over time. And also the drying, more drying during the dry season and more rains during the rainy season. So these are just manifestations of different climate change or climate change. So climate change, environmental factors are intrinsically linked with human health. Okay, so of course, when we experience typhoon, or for example, or natural disaster, it can affect our mental health. We feel anxious or sometimes depressed, or even our properties are affected when there is a catastrophic disaster. And so it has intrinsically affected also the human health. And WHO predicted by 2030 that the health costs associated with climate change could reach about from $2 billion to $4 billion annually. And of course, not just the health in general, but also the health workers are affected by climate change or also vulnerable to environmental risks. So they serve as like I said, like push factors. They push individuals and health professionals to leave the country and work abroad. So that's what we're trying to study in this paper. So like I said, in this research, we aim to explore the connection and correlation between environmental risks and the migration of health professionals. So it's kind of a novel empirical research. And so we cannot, it's hard to draw on a single strand of literature. That's why we kind of combine or link two strands of literature in this paper. And our prediction is that it's positive. Like the higher the more intense the weather and more damaging the typhoon, the more health professionals will migrate abroad. So these are the different ways or pathways through which environmental factors, adverse environmental factors, could affect eventually international migration through physical health impacts, be affected by the typhoon, mental, like I've already mentioned, internal displacement within the country, even loss in personal income and properties, and even lost lives, their families. So briefly, the data that we used, we actually combined several data sets. We merged them, so they're from different sources. From the migration data we got from Department of Migrant Workers and CFO, and then we also have the weather data from Pagasa, and then we also got different socioeconomic factors, demographic variables, and also infrastructure variables from Philippine Statistics Authority. So we merged these data sets and constructed a panel data set from from 2003 to 2023 for permanent migration, and for temporary migration from 2018 to 2024. And this is a provincial data. So there are about 81, 82 provinces in the Philippines. And then we also included the 4 districts in Metro Manila as provinces. So here it's just a data. I didn't show everything, but the first part is from, like I said, Department of Migrant Workers. So the way to read this is that, for example, for total health workers, there are about 30 health workers who migrated permanently per province on average from 2003 to 2020. And on maximum, about 886 per year for one province migrated permanently. And then for temporary migration, you can see that the mean is higher. So annually per province, on average, 171 of health workers migrated. And then mostly nurses and also female nurses. Then we got the tropical cyclones, the shock variables from Pag-asa, from the weather stations in the Philippines. And we classify them based on wind intensity. So there are 5 categories, and then we also have the total tropical cyclones. So the first 5, the annual frequency will constitute the categorical variables that we have. The total tropical cyclone would be the continuous variable, meaning from what is the effect on migration as you increase tropical cyclone by 1 more per year per province. Whereas the first 5, you're comparing the intensity. And we got the first one, tropical depression, as the base for the reference category. Then the second panel for casualties and damages. So here we measure the annual number of deaths per province over the years, 2003 to 2023 and 2018 to 2024. So about, on average, per year per province, about 7 deaths from 2003 to 2023. Then affected families, about 18 per province. And then cost of damage in millions of pesos. And then cost of damage to agriculture and to infrastructure. Okay, so these are the different control variables that we used, and we got from Philippine Statistics Authority. So we got the inflation rate, so on average, 4% inflation rate per province over the years, over the time horizon that we are analyzing. Unemployment rate, about 6% on average. Household income, 222 pesos on average. Poverty threshold, 21%. The number of elementary schools, secondary, we also included to measure the infrastructure, the number of hospitals also, and household size to measure the demographic variable. Questions? Okay. Okay, so these are the models that we used. So I'm just going to present the second part, the 2-stage least squares fixed effects. The first one is the reduced form. When I say reduced form, it means that we predict the weather shocks, WS, to affect migration, which is on the left-hand side. And we predict that it is positive, meaning beta 1, the coefficient, we predict that to be positive. On the second stage, we actually dissect the model in 2 stages. First, that the weather shock will cause casualties and damages. And on the second stage, the casualties and damages will affect migration. Okay, so it's a 2-stage model. Okay, so briefly, this is the hypothesis development. Our hypotheses are illustrated in this illustration or in this picture. Okay, so we have H1, which is the first alternative hypothesis. We predict that the extreme weather event will affect migration directly, and it is positive. We also predict on the third alternative hypothesis, H3, we predict that it's going to be 2-stage. And then the second one, the second arrow here, represents heterogeneous effects, the nuanced effects, meaning that the impact of weather shocks on migration is not homogeneous and it's not direct, but there are different layers. Depending on the duration of migration, we predict that the impact of weather or environmental factors on migration depends on whether it is permanent or temporary. Also, the gender of the health worker, the country of destination can also be affected, and also the type of damage. Okay, so let me show you briefly the results. I excluded the statistically insignificant coefficients or variables and will only show to you the significant variables. Since this is also a working paper, so I'm trying to guard the results. So, okay, so in this table, the first table, this is the 2-stage effect. So on the first column, you see that the tropical cyclones, the numbers, the coefficients are positive and statistically significant, meaning the more intense a tropical cyclone is, the more the casualties, or in this case, measured in the number of deaths. Okay, so this is positively correlated. And then we see actually that as the number of casualties or number of deaths increases, there's actually more out-migration of doctors from the Philippines. Okay. Yeah, okay. So, yeah, so, and then the same pattern is observed, for example, for affected families. So we see that the more intense tropical cyclones, the more the number of affected families, adversely affected by typhoons. And then we also see that as the number of affected families increases, we also see, again, the increase in migration of doctors, regardless of gender and destination. Another interesting finding we found is that the poverty threshold is inversely correlated with migration. So the poorer a province is, the less likely the migration of medical doctors. Again, similar findings when we measure damages to houses, similar positive correlation between typhoons and damages, and similar positive correlation between damaged houses and migration. And another interesting thing here is that actually, if you looked at the last column, this is like the lagged effect. This is a year later after the event has occurred. And so we saw that there's persistence in the effect, that there is still an increase in migration even a year later after the shock. And the same with damaged agriculture, same increase in migration of medical doctors, and then again it persists over time, and the same with infrastructure. So consistent results, regardless of how we measure the damages and casualties. Questions? Okay, so, but here's the interesting part. When we looked at the temporary migration, instead of finding an increase in migration, there's actually a decrease in migration. And it's not the doctors, but actually the nurses who choose to stay in the Philippines when there is a catastrophe or natural disaster. So, for example, as the tropical cyclones, as they intensify, the damage to families increases. But we found that as more families are affected, the nurses actually stay in the country relative to, as opposed to the doctors. So here we saw a negative correlation. So the affected families are negative. And then we actually saw that this persists even 2 years later. Sorry. So this is another interesting part. So the nurses stay, but actually 2 years later, they migrate. So they still migrate, but on the year of the weather shock, they choose to stay in the Philippines. And then, so the same with damaged houses. So again, the intensity of the typhoon affects positively the number of damaged houses. But again, then the damaged houses actually, as the number of damaged houses increases, the out-migration actually decreases for temporary nurses. And we see a gendered results, because in this case, it's the male nurses who actually decrease their temporary migration. Whereas with the affected families, it's the female health workers who stay in the country. So that's it. So I just showed briefly. So the summary of the results, basically, so I skipped the fixed effects part, just the two-stage, but the results are consistent. So basically, environmental factors such as intense typhoons could affect migration. And our prediction of a positive effect is actually more nuanced. No? So depending on whether it's permanent migration or temporary migration. So although the adverse environmental factors or environmental risks in the Philippines push doctors to leave the country for permanently, but the nurses, they actually stay for temporary migration. And then, like I said, we saw it like it's sort of a gender role or gender norm. When it's the affected families that increases, it's the female health workers who stay. And maybe because they take care of the families, their role to care for the families. But when it's the damaged houses, it's actually the male nurses who stay. So again, probably they're out fixing or reconstructing for reconstruction of houses. So our results support the Sustainable Development Goals 3 and 13. And our suggestion or policy suggestion is that because there are two strands here, like the migration and also making sure that we have enough nurses in the country. So we suggest that the government sort of balance the migration policies, protecting the migrant workers, but at the same time, have in sufficient like infrastructure or remuneration for this health workers so that we have enough or sufficient stock in the country, especially in the face of environmental factors. And also we're suggesting that not just incentivizing them financially, but also making sure that the institutions or the markets are even though not perfect, but existing. So like the simple credit markets, insurance markets, so that when these healthcare workers or even Filipinos experience a natural disaster, they can cope ex post. But also you want them to cope ex ante, even before the natural disaster happens. So maybe having sufficient infrastructure in place, etc. So that the environmental risks do not serve do not cause aggressive out migration. Some future research considerations when data become available. So Other environmental factors can be considered like flooding, rising sea levels, and more intense rainfall. And then other pull factors like factors from the US and also the European countries, like the factors that could pull migrants to migrate to these countries. So that's it. Thank you.
Thank you very much. We're delighted again to hear your remarks, and we'll turn in a moment to open for a question and answer. And I do want to remind you, we have some folks online, and I'm going to be alternating between some in-person and some online questions. Let me remind those of you who are here with us that we do have mics in front of you, and in order to activate them, you want to hit the button, and you'll see a red light turn on. That's a good sign. That means it's hot. And then when you finish speaking, make sure you shut it off. As well as I call on you, if you could please introduce yourselves and just let us know introduce yourself. And then so on that, let me go ahead and we've heard obviously a range of things, and thank you for sharing. For me, it's always fascinating to see the complex push and pull factors and how you've been able to drill a little deeper to separate even the temporary versus the more permanent. But let me instead, I'd like to turn it over and maybe open it to anybody in the audience here that's in person to begin any questions. So please go ahead. And again, grab one of the mics, and you'll want to hit the button for a red light to come on. And please introduce yourself. Thank you.
Thank you. I'm Rana Hassan, recently retired from ADB. A very interesting paper. One thing I could not understand is why you used two-stage least squares, because I think the issue of weather shocks is pretty exogenous across provinces,
Yes.
right? It's not a policy variable. I see this as something really truly exogenous. So couldn't you just have done a single
Yes, we
regression?
did. We did.
And
I-
would
and
the
it's
results be similar?
Yes, consistent. I didn't show that because I just want to show the more elaborate model. We did the two-stage because of course weather shocks are exogenous, and running a reduced form directly affecting the migration is valid, and we've done that. But also because of the pathways through which climate change could affect migration could be indirect also. Like it could affect their income first and then they migrate, or it could affect their properties first and then they migrate. So we added that layer in our analysis. Thank you.
Iya Mazinga, fascinating presentation. I actually had two questions. Is there a correlation between disease factor, particularly acute respiratory infections, gastro infections, and leprosy related to the placement and the retaining of the doctors and or nurses? That's one question. And then the other question is, the Philippines has a reputation of producing a lot of persons with science degrees, yet there is a leak of pipeline where only about 46% of females actually transition to those professions that, and nursing being one, make that connection.
Okay, so I think your first connection, sort of the correlation between health outcome and the shortage of nurses in an area. Sort of like
Shortage
that.
and placement and
Yes.
its retention
Yes, so
related
That's-
to the diseases.
yeah, so that's not, we didn't find that. That's not part of the research, but actually that's our next research. Because I found that they're linked. You know, it's not just also the number of nurses or health workers in a place, but also the skills that they have. Okay, so yeah, so that's an interesting question, and that will be in our next paper.
And if I might, one other question.
Uh-huh.
When I was in China, I noticed that the Filipino nurses particularly had the ability to open up banks during Saturday when all the other banks were not open, and open up money exchange places when all the other places were not open to everyone else.
Mhm.
And so does infrastructure have anything to do with recruitment, placement, retention?
Sure. Yeah. So the existing infrastructure actually helps. or encourages migration. So for example, not just even the banks or even like when they send remittances, for example, but some have like direct tie-ups with the some nursing schools in the Philippines, for example. So like from Germany, they're training the nurses to speak the language, for example, making it easier for them to migrate. So like this, yeah, so in effect, all these institutions in place actually also help in migration. Thank you.
Hi, my name is Pan Win. I am a research fellow here at the East West Center. I also have a question about 2SLS. Since you use 2SLS, what are your instruments that are being used in the
Oh, the instrumental variables
Yeah.
are the casualties and damages.
Oh, I see. Do you also look at like the pathways? I know you mentioned like the very comprehensive pathway at the beginning of the slides of your presentation. Do you look at how those pathways affects how environmental risks influences migration?
Yeah, so because of data constraints, we can only look at the effects on their properties and income through casualties and damages, and also effects on infrastructure. But the mental health effects, we don't have measure for them, or even the internal displacement, because we don't have data, a good or robust data on internal migration. So given the data that we have, the best possible variables are the casualties and damages.
Oh, I see. What about like decline in employment opportunities?
Oh, that's
in-
part of the control variable,
Oh, I see.
the employment rate.
Okay.
Yeah.
And my last question is, you mentioned there's a variable for debt and
Yeah,
also
so
for household
casualties and
size.
deaths.
I'm just wondering, because the data is at the provincial level, how do you define like household size in your model?
It's the average household size
Oh, I
per
see.
province.
I guess my concern is that because it would be the average household size at the provincial level, there would not be a lot of variations in that variable.
Yeah, but
Yeah.
similarly, yeah, so that's true, but still sufficient to run the regression. So
Okay.
there could still be 87 provinces, variation across 87 provinces over 2 decades, 20 years. So that's still 1,600 data. It's still enough variation because it's not just per province, over time.
I see. What about the debt? Is that household level or like
Provincial
individual?
level.
Provincial
So
level.
number of deaths per province once the different typhoons crossed the provinces.
I see. Okay, cool. Thank you.
Now it's on.
Okay. Thank you so much. First of all, I admire your English and your presentation. It's very good. I was wondering, I'm not an economist. I'm not good in statistics. I was wondering if you have good data to show whether the bad region, like the east, some, I've been to Philippines once, and then the region like Abe and Cameroons, those terrible places where have the bad weather. Do you have good data to show people in that area there are more migration than the area where they have good weathers? Okay, that'd be very, if weather is very good
Okay,
as
I see
an
what you mean.
indicator, I think in the future maybe you can bring that differences. The data is more be interesting.
Yeah.
The other thing I'm thinking about, if the weather is your most important dependent variable, I just assume when they go to work in a place, right, they would choose the good weather place, right? Just assume that, because they are from bad weather place, they don't want to go to another bad weather place.
Correct.
But the most popular place, as far as I know, is in Canada, and the bad weather place in a very, very cold region, right? And the Philippine people were not used to it, but they were willing to go there. So I think that I come here, I want to find out, the weather existed, the weather, bad weather existed in Philippines for ages.
Mhm.
But why there's a surge of migration, especially healthcare workers, tremendously. So I think that for me is very important to really find out if it's the weather or maybe something you mentioned but not detailed. I went to Philippines, I discovered a lot of very poor institutions. You talk about healthcare is another one thing. The other is, the whole market development is very poor. So, so I'm thinking about people probably will, I think there'll be, if you use environment, weather is mostly dependent variable, you do not give enough power to those, including domestic helpers, the credit. I admire them. I interviewed so many Filipino women in Hong Kong and even in China. I think they're entrepreneurs for me. I think for me, the most important factor is that the Philippine culture has a very entrepreneurial spirit, looking for opportunities everywhere. So when there's opportunity come, when there's shortage, they grab it. And the first one they can do it. So they're smartest. This is what I look at the things. If you look at the weather, it's more passive. So I want to bring out more entrepreneurial aspect of the women in Philippines to look at the migration and the rise of thing. That's one thing. The other is more side, it's more what I'm interested in, whether we can help. Is that these are specified for nurses, right?
Mhm.
Is still in existence or right now curtailed?
Which
The kind of
one?
nurse visa, yeah, the nurses and professional,
Yeah, still existing. Yeah.
they still exist, but just take some time, right?
Yeah.
Like that. So we should really, maybe all of us, this was center, we should push for more visa,
Visa expansion,
more free.
expansionary
We can
visa
get more.
policies.
We want to get more of them. So,
Yes.
but anyway, we can talk tonight more about it. But anyway, I admire your presentation. And
Thank you.
But I think that this is what I might kind of, there are other variables I want to look at.
Sure. Yeah.
Let me go ahead and I'll take the opportunity to weigh in with I guess a two-part question. One is, your work obviously is in some ways helping inform policy, what are the opportunities, needs, maybe the role of the Philippine government and things like that. And I wonder first if you might share some examples of either recent or maybe not happening now, government policies, ways in which the government has either helped support those coming back or those going, because how do you balance that with obviously the very large remittances that government also benefits from? And yet, as you also have now a long track record of many professionals who now they've gained experience, now they come back. And maybe the second part is that you have a long track record now, 20, 25 years of let's say these workers, but there's a different world today, both back home, whether opportunities or new technologies or returning with their experience in ways that maybe 25 years ago was a different reality. So just maybe a little bit about both the government policies and then maybe how these changing dynamics of, again, the returning workers that bring experiences and the needs that your country has itself. You don't want to send everybody away because you have to
Keep them. Yeah.
keep some.
Yeah. Actually, the same questions in Stanford. They asked me about the existing policies and also how do you retain and also the returning workers. So I think it's not only just health workers, like retaining them and also making sure that they return, but also, like she also mentioned, what about other types of migrant workers? And I try to look for the policies that would actually help them return or even make them stay. And I don't think I've seen, yeah, not much policies. For example, I know some for the PhD graduates here in the US, we are given incentives to go back home and not stay. So we are given certain amount of money to go back. It's like balik scientists or like scientists, encouraging scientists to go back to the Philippines. But I don't know in general about other like healthcare workers, how to make them return or like keep them in the Philippines. And also another issue is like the unequal distribution of skilled nurses across the country. So like the rural areas, so there's a skewed distribution. Obviously, most of them are centered in Manila, for example. So that's another issue. And I think one of the programs is about like before they work or choose to migrate, they have to, after graduation, they have to first serve locally, like a rural area, a year or two. I think that's a good policy also. Yeah, but I think that's the next step, like making sure that we have sufficient and robust policies to, yeah, like you said, just keep some to ourselves, some in the country. Mm.
Would help those out.
Oh,
Comes with all around.
yeah.
But, but then it's also.
Mm. Yeah.
But maybe just to follow up, I mean, what I was getting at is, you have a world where, let's say it's very different from the year 2000 when you were migrating out and.
Mm-hmm. Mm-hmm.
You know, we're increasingly see maybe a revert flow, people coming back,
Mhm.
but also have better circumstances than when I came.
Yeah. So yeah, that would be good to compare 2000 and then the now, like the present condition, whether it's still conducive or not conducive to stay in the country.
Thank you. Let's turn to see if we have any others. Yes, please, go ahead.
Yes, my name is Carl Eschbach. I'm a retired health demographer, retired from the University of Texas Medical Branch in Galveston, Texas. And I'm trying to get a grip on what the model is doing. You've got 87 regions and 20 years of the regions are presumably, oh, actually, and the outcome variable is the count or of migrants, international migrants from each province. Now the provinces are presumably extremely heterogeneous in size, and I guess the other thing I'm trying to wrap around. So you've got different intensities of, say, tropical cyclone impacts. These are presumably both temporally and spatially correlated, which is to say, in bad years, they're differently bad in different provinces,
Mm-hmm.
but presumably in bad typhoon years, all provinces are somewhat affected. And presumably also there's spatial autocorrelation across, I mean, that near areas are affected more than far areas. So how do you handle all that?
It's a good question. So like the autocorrelation across space and across time. Across space, it's so there's a technique in econometrics, so we make sure that the standard errors are robust, so any differences across space could hopefully handle that. Across time, just I don't know, including, because we've also included year dummies, so the year effects could it are included in the paper also.
So how does the size of the province and I mean the number of professionals available to migrate affect the model?
Yeah, so that's a good question. We didn't consider the size of the province. In the previous paper, the one that has been published, we grouped the provinces actually into islands. So that kind of addresses the differences in climate, differences in the size when we did that. But in this paper, yeah, we didn't account for the size of the population or the population. We had just the household size. The population, let me see, unemployment rate. We got rates, so relative to labor force, but in terms of population, no, we did not. But it's quite easy. We could make like per capita, just the variables that we have divide by the population. Yeah, that's a good question. Thank you.
I had another question. How does civic unrest affect the environment in terms of recruitment and retention of nurses? And then there's something that's now coming about, traveling nurses, where nurses can accompany an individual and they can go to several places. Were you able to track the movement of one single nurse to more than one location and the reason why they moved, other than environment?
No.
And how does civic unrest in certain regions affect retention, recruitment, placement?
Yes. So first, we cannot include all factors in our model. So the civic unrest, I presume that it affects the income of a province. If there's civic unrest, then
In certain provinces.
in certain provinces, then more likely they have higher poverty threshold and more likely lower income. So through those variables, we've accounted for them. But traveling nurses, it's too complicated to include, like they migrate from one place, then go to another place. So there's no way, there's no data to track this. But that's interesting. That's an interesting info.
So just coming back to one of your key results, which I think is that once you have this shock, it's temporary migration, which actually goes down, the permanent goes up.
Yes.
And I'm just trying to understand why that's happening. So it's a negative income shock. The province suddenly has less, in some sense, income, but maybe more opportunities for health work, and you're actually seeing
An increase in migration.
permanent. Now, what I guess one thing I also don't understand is when a person decides to migrate, what determines whether it's going to be temporary or permanent? And because that, I think, becomes important to see if there's some really interesting policy relevant stuff happening here in these two different responses, or is it just something completely random?
No, it's not random. So there's so like new migration economics or new migration economics. That's basically saying that migration is a household decision, and that households usually try to distribute risks, and so they would send members to other countries of different risks so as to distribute the risks. So there's that. One explanation that I could think of is that permanent migration is a big decision, right? And in the migration theory, basically, the model includes consideration of your lifetime earnings, your future stream of earnings versus all the other costs associated with your migration, including settlement, the cost of settling to another country, but also all the psychological costs and environmental costs associated with staying in the country. So the way I see it or interpret it is that with permanent migration, you have this consideration of a longer time horizon. And meaning, if there are more weather shocks that they've considered in the cost, like it's a cost for them of staying, then in the model, so income minus cost, simple income minus cost. And therefore, it's costly for them to stay, then they've already considered that in their decision to migrate. So meaning it not just one single shock affecting them, but it's like seeing all these shocks over time. So it's like it doesn't matter what the type of shock really is at this point. They will still migrate after considering all the factors. That's why the results persist over time. I don't know if that's a, it's a,
Permanent migrants or nurses, is there a, or is it like a,
yeah. So we also looked at that. Who are the actual the ones who actually migrate more? But we actually found that in terms of percentage, a lot of nurses permanently migrate also. So it's not even the number, the sheer number.
So we're going to have two more. You've got your hand up, and then Panwin will have the last word. But go ahead.
Okay. So I have a completely different kind of question, which is how does the process of international recruitment of health workers work? And I mean, your mechanism for talking about the effects has been about nurses staying when there are large impacts, but I'm just kind of curious as to when a nurse decides to work internationally, does he or she get on a plane and leave, or is there a 6-month recruitment process and expenses paid at the other end? Just how does that work, and how does that factor into?
Yeah, so there's a
how this would work?
there is a recruitment process. So recruitment process. So most of them already have jobs before they leave the country. Like I said, some have like tie-ups with nursing schools in the Philippines. Like it's this German hospital linking with the nursing school in the country. So when they leave the country, they already have a certain destination in that case. In that part, we didn't consider in the model. Like so that's one of the future research project that we're aiming when the data becomes available, considering all these networks and all the recruitment policies also. Thank you.
A final question here for Panwin, please.
Have results for your heterogeneity effects, like focusing on gender.
Sorry, what?
Did you check for heterogeneity effects?
Yeah.
For your results?
Yeah, so the results are, so the heterogeneous effects, basically we split the data sets into sub data sets. And then, for example, male nurses versus female nurses. But like to add that gender variable in the model across whether, so no, not that way. Heterogeneous in terms of subdividing the data sets.
Yeah, because I think once you check that, I think you might have evidence-based explanation to address those interesting results.
Yeah, but the heterogeneous effects, it's kind of tricky in this case because, for example, gender is not, it's time invariant. So you have to interact it with a time variant variable, right? So which time variant variable are you gonna interact it with? The casualties and damages. So yeah, so it's kind of tricky to interact it with a time variant variable in this case. We've considered that, but the best approach to look at heterogeneous effects would be to subdivide the data set.
Well, thank you so much. I want to basically thank you for joining us and sharing remarks on this recent work you've completed now at Stanford, and really grateful also for your support here at the East West Center. You've been able to join our Asian Pacific Leadership Program and talk with some of these young leaders, one of our flagship groups that's here for, I think, 25 years in a row.
Yes.
And thank you. Any quick thoughts or reflections on that you were joining them this morning?
From APLP, yeah, it's a good crowd.
Excellent.
Very engaging and very, yeah.
Great. Well,
nice.
we're again grateful for your support. I want to thank also Jamin and who else? Kenna, who's not with us here, but our support staff that helped bring these
Yes.
programs together. Thank you for the audience, all of you for joining us online. We had another fair, good-sized group. I want to remind all of you there is a YouTube recording that will be posted on our channel and that you'll be able to share with any friends or colleagues if you missed it. Well, again, it'll be a YouTube file that'll be available on our channel. Beyond that, let me just have you remind you we do have some upcoming talks. We're still firming up exact dates, but we're looking probably next week, we'll have a more of a roundtable discussion with one of our visiting scholars that's here, Vinny Agarwal. And in a few weeks, we're hosting another visitor that comes every summer to us, Victor Cha from Washington, D.C., giving us a talk. We'll get those dates out to you pretty soon. Thank you again for joining us, and stay tuned and keep checking our East West Center events for the next opportunity to join us.
Thank you so much.